Hey, thanks for joining me for this video. I'm really excited about this new series of videos that I'm calling The Rules of Medicine. When I say medicine, I'm not talking about the little pills that you take, I'm talking about the practice of medicine. My interest in having a set of rules that govern the practice of medicine really started when I read this novel by Samuel Shem, The House of God. If you're looking this up, I have to warn you, it is not politically correct. The title of this video is Trust No One. This may be the most important rule when you are practicing medicine. The background for this rule of trusting no one when you practice medicine really comes from the concept that medical error is extremely common. Medical error is a source of shame for healthcare providers. It's often not recognized. Often not by the person committing the error, and even those around them may not recognize medical error when it occurs. When it is recognized, it's often not reported, and so estimates of how often medical error contributes to poor outcomes in medicine is unclear, but it is estimated to be the third leading cause of death in the United States. Despite a culture of perfectionism, all healthcare providers will make mistakes. We often employ fear-based strategies to try to avoid medical error. We order too many tests. We get too many people involved in the care of the patient. We often resort to strategies that are designed to protect us rather than focusing on simply doing the best job that we can. The current system or preferred strategy for managing medical error is to blame the system rather than blaming the doctor. At least that's what we give lip service to. Despite the lip service that we give to this concept of blaming the system for medical error as opposed to blaming the individual, lawyers, judges, even accreditors seem to prefer to believe that accountability for medical error still lies with the individual as opposed to the system. Given that you are going to commit medical error if you are a healthcare provider, you might as well start now thinking about how you're going to feel in the aftermath of medical error that you commit. Studies have shown that doctors who commit medical error experience guilt, sadness, sleeplessness, difficulty concentrating, anxiety, even panic in the aftermath of a medical error. Many logically express fear of lawsuits, fear of damage to their reputation. Depending on what jurisdiction you work in, if you're in the United States, the fear of lawsuits is escalated compared to many other jurisdictions. Even a year after a medical error occurs, studies have shown that doctors report diminished appetite, poor concentration, symptoms of depression. So this is a big deal. You are going to feel terrible. Given that you're going to feel terrible after you commit medical error, then you might as well ask yourself, what is the minimum standard for your behavior that will allow you to say, I have no regrets. I did what I could to avoid the error before it happened. That's where this rule of trust no one comes from. This rule is not intended to be cynical. It's not intended to be paranoid. It's not a strategy that allows you to stop trying for the very best outcome for your patients. It's not narcissistic. The rule isn't trust only yourself. You have to throw yourself under the trust bus and assume that you are not any better than any of your colleagues who are working in the same system as you are. What this rule is a mental exercise that will force you to behave so that you will have no regrets, or at least less regrets, when medical error occurs. Okay, so how does this work? Well, what we do is we break down each step within the practice of medicine, and we maintain a high index of suspicion. So, you're sitting there reviewing your referrals. You should assume that the referring doctor didn't tell the patient anything about why they're coming to see you. They didn't tell the patient anything about who you are or what kind of a problem you may be able to fix. The reason the patient thinks they're coming to see you is quite different from the reason that you think they're coming to see you. These assumptions help me a lot when, as an internist, the patient asks me when I'm going to schedule them for their orthopedic surgery, for example. When you walk into the room and meet that patient for the first time, you should assume that the patient isn't where they're supposed to be or where you've been told that they are. If you have a nice looking typed official looking list of patients' names and room numbers, you should assume that this list is incorrect. These assumptions will help you make sure that you identify yourself correctly to the patient and that you make sure that you don't wait until you've finished taking the history before figuring out that you're actually not talking to the correct patient. If you happen to be a surgeon, this strategy of assuming that you don't know who is in front of you will probably help you avoid removing body parts from the wrong patient. When you review the medical records on your patient, perhaps before you see them, perhaps afterwards, you should assume that notes that appear similar have been copied and pasted, and that they probably include errors that have been propagated through this copying and pasting process. I've often wanted to put something in my notes that says something completely outrageous like, "This patient's father was a beagle." And then just see how often that medical error gets propagated through copying and pasting of notes. I think the findings might be surprising. You should definitely assume that the medication list is completely wrong. Even if you talk to the pharmacist directly, the patient probably isn't taking what the pharmacist thinks that they're taking. When you actually speak to the patient to get their medical history, you should assume that most of the important details won't be remembered. For example, moms of babies born with phocomelia deny taking thalidomide even when it can be proven that they actually received thalidomide. You should assume when you're taking a medical history that you're being manipulated, especially if the patient reports doing research on their own health condition. If a patient has a substance use disorder, or they're a teenager, or close to being a teenager, it's quite probable that nothing that is vocalized by the patient will actually help you arrive at a correct diagnosis. I do have teenage children presently. When you review a patient's test results, you should assume that the blood work you're looking at belongs to the patient in the bed next to your patient. You should assume that voice recognition software used by the radiologist in reporting the scan substituted the word malignancy for the word officially, completely changing the meaning of the report. You should assume that the time, if not the date, has been changed. You should assume that right, for example, the right adrenal gland has actually been changed to left, and vice versa. When you order treatments for a patient, you should assume that if the route can be wrong, it will be. For example, intravenous calcium chloride will be given subcutaneously. Oral methotrexate will be given intrathecally. You should assume that the dose of drugs will be adjusted by 10, either up or down. So for example, if you order 10 milligrams of warfarin, it'll actually become 100 milligrams. You should assume when you write a prescription for a patient that their health plan won't cover whatever medication it is you think that they need. You should assume after you've done a fantastic job communicating why the patient needs that particular drug to prevent strokes, for example, that their next door neighbor who supports himself doing TikTok videos will disagree with you, and the patient will probably end up going with their next door neighbor's opinion because they have learned the rule, trust no one, very well. Finally, The most important part of this rule is that you should not trust yourself. If you've navigated all the other issues around how you interact with your patients, and you're very happy that you will have no regrets if a medical error occurs, you come to the most important part, which is you have to say, I'm not going to trust myself. So if you're absolutely certain you can remember that patient's kidney test results as you're ordering the drug that's retained in the setting of kidney failure, check again. If you think you know the patient's echocardiogram results when you're ordering their blood pressure pill, check again. If you've done a bang-up job of explaining why that amputation is so necessary for your patient, and done a wonderful job of getting consent, trust no one. Check again. Make sure the patient understands what was discussed. Finally, be open. Ask questions, be skeptical, be humble, and do your best. But trust no one. Thanks for watching this video.